a phone call from my ID and everybody else.
Okay. Brian, I called them, talked with the triagist, and they can't accept you as a transfer. If you go there to the ER, they'll evaluate you for admission. But their hospital's full. They're waiting on 15 patients to be admitted right now, so their bed wait is through the weekend. So they can't accept. I wish I could do more for you, Angela. I really do.
Y'all put me in this position.
I'm sorry.
Y'all put me in this position. Y'all know that, right?
What?
To prove that I wasn't anorexic, y'all made me shove a tube down my nose. To prove that I wasn't anorexic, because y'all don't believe that I'm not anorexic. Y'all think I'm doing this to myself.
The tube down your nose is to give you nutrition, not to prove anything.
No, I told her I didn't want anybody putting anything in my body that I didn't have control over, because the last time I did, nobody took care of it and had to go to Virginia to take care of it, where I get answers.
Yeah.
Where I found answers. Where I finally found answers, because I set up a whole team out there.
Mm-hmm.
And they worked me up, and they found answers. Didn't take a day. I was in next day with ID. Out there. Here, I can't even get a time of day.
Mm-hmm.
I have a candida infection. I don't just go around craving diflucan, okay? Like, I'm not a diflucan narkhead, all right?
Mm-hmm.
Like, why wouldn't you want to find out why my body wants it? Why my body feels 100 times better when I'm on it? I even said metronidazole helped a little bit. I said azoles in general. I look it up. My exact problem is solved by azoles. And if can't be, because it's been long enough now, almost a year on and off, I'm probably going to need the ampicillin B or whatever it is. And like, y'all put me in this position by not evaluating me and calling me crazy to begin with. To have to go all the way to Virginia and set up a whole entire team of people to take care of me.
Mm-hmm.
Because of the care that I wasn't getting here, that I should have been getting, that allowed me to go into failure to thrive. Now I'm in refeeding syndrome if I try to eat.
Well, that's not true. We have your electrolytes are totally normal.
Right, but if I leave this hospital with this tube in my nose and I try to feed and refeed and then eat, I'm going to put myself into refeeding syndrome.
We're through the refeeding syndrome window. That's not a concern of me for me anymore.
No, I don't think that should be off your radar, because
You've been getting tube feeds now for several days. Refeeding usually happens in the first couple days of restarting nutrition.
Okay, well, I'm not your average patient, and I don't show normal signs, hence why I have to argue with people all the time about everything. But I need a telephone, because my infectious disease doctor tried to call me yesterday and he couldn't get a hold of me, and I'm wondering if that's why. But my phone went SOS, so I don't even have internet connection. I need something with internet connection so I can get in touch with my ID provider.
Can you connect to the guest Wi-Fi?
It won't let me.
There's a
It's
phone
not.
behind you if
It
you know
won't
the
dial
number.
out. We tried it.
Okay.
I need a phone though, so I can call my doctors, so I can set up a plan.
Okay. I'll let your
because,
nurse know that part.
Y'all now got me like this, and
Do you still want to go today?
and y'all got. What am I hanging here for? So y'all can deprive me of my meds and dehydrate me? And skimp me and do what? What have y'all done for me? What in 16 days have y'all done for me?
What I want to do on my time with you, Angela, is what I can speak about. I want to get you on a nutrition regimen that you can use at home.
Okay, well,
So you
that's
can
a hard time
survive.
whenever, right, but see, if you don't treat the source of the problem, then that's the problem.
Yeah.
Because diflucan opened everything up, including my bowels. I suffered 10 months of gastroparesis. After 4 days of diflucan.
And I'm not holding the diflucan out.
No,
of
I'm
you.
not saying that. I'm just saying. There's a correlation there.
Yeah.
I've been saying something's been crawling in my stomach for months. I've been saying I've been having a fungal infection for months, and guess what comes back positive? And it just happens to be by chance. Fuck that. That's not even accurate. That I've literally been having nothing but clinical symptoms of fungal infection for almost a year now. Been trying to tell you people. And y'all focus only on blood infection instead of anywhere else. And like I said, I figured it out by just trying the diflucan to see what happened. And I went home and I crapped out a month's worth of crap for 3 days. Completely ungastroparetic.
I truly hope you get the answer you need.
No, I know, I have the answer. I just need the help.
Yeah. So these are the two options that I have for you. I can discharge you today.
You're going to discharge me in bad shape because I'm going to go home.
I don't have everything set up for this yet, so I can't discharge you with your tube feeds yet because it's not set up. If you want to stay to get that set up,
but why haven't you set it up yet?
Because we haven't shown that you can tolerate it. So what we need to show is that you can tolerate nocturnal tube feeds, which is what we were going to do tonight, me and Caitlin, the nutritionist. And if that's shown to be tolerable, my social worker has already started getting those things in the works so that we could get these things approved for you. I don't know when that'll be. My goal has always been Friday, but I don't know. I'm not going to bullshit you and tell you that I know, because I don't. I don't know when it'll be. Okay? That's the truth. That's the truth I've been telling you all week. It's what I can control.
You haven't concentrated on anything else, though. You haven't concentrated on the source of why I even need this.
So at the end of the day, it's up to you what you want to do. If you want to stay here and try to get tube feeds set up before you go so that you have that as your support for nutrition until you can get to Virginia, that would be what I recommend. If you want to go today, that is your decision.
But I have to leave Tuesday.
Tuesday for what?
Virginia.
That can be done. My goal is Friday.
You're going to dehydrate me before I get there. And then you're going to send me home over a weekend, or a holiday weekend at that. When my electrolytes literally are so unstable that I don't even feel like things because I ignore them because y'all call me crazy when I try to come in and get evaluated.
Yeah, your electrolytes are normal now. It's been 3 days in a row.
Because I've been on diflucan. It finally kicked in.
Yeah, and that's possible.
No, I know it is. I've proven it over and over again with labs.
Okay. What do you want to do today? Do you want to talk with your husband and then let your nurse know to call me when you've made that decision?
How does gastro just change their mind and
I think it's because it's a different provider today that's doing the procedures.
They came in last night and made me sign a consent form for it.
I know. I just talked with their attending again to say we need to have somebody come by and explain this to you.
Well, I don't understand how they just change it.
For right now,
Different provider doesn't know me. He's never even talked to me, and he's going to change my plan of care.
I think he's trying to do it to avoid a procedure.
It's already been done. That was supposed to show more accuracy. That was why the procedure was ordered.
Yeah.
Was for more accuracy.
Mm-hmm.
So why order the same test over again?
I don't know that answer.
Well, that's what I'm asking. That's definition of stupidity. That's the reason why I hate the ERs, because they run the most basic of tests and then tell you you're normal and then walk out. Well, guess what? The lady, whatever her name was, last week told me I was perfectly normal and fine to go home. Come to find out I was anemic enough to get 6 rounds of iron.
Mm-hmm.
But I was fine to go home. There was nothing wrong with me. So, like, if you run out of the testing, you run, a little bit out of the box there for a minute, as you should with a patient with me, you might find some answers. But y'all aren't willing to do that. Y'all are like this tight-knit box of reference ranges. I had Graves' disease, and my ultrasound was normal, and enlarged thyroid because I was having clicking in my throat, but normal. No follow up needed. A couple cold nodules. T3, T4, perfect midline. 0.01 off on TSH, snubbed off, right? Just a fluke, just a minor low, no big deal. It'll go away. Graves' disease, no antibodies, zero antibodies. I don't present normally. I don't have fever. I went my whole septic time in Virginia. I never once ran a fever. The fever I run is like 99. And when I told the doctors that, they brushed it off. That was when I wasn't getting my Deflucan. Now that I'm getting my Deflucan again, guess what?
Okay, you talk with your husband and decide what you want to do, okay, Angela?
Need to get to somebody who will listen, because...
If you want to go to Bryan, I'll discharge you today. If you want to go to Virginia, I think your best bet is to wait until we have tube feed set. But that's your decision, okay?
And go to Bryan for what? So they can,
that was your preference.
so they can discharge me?
I don't know what they'll do there.
No, they're going to discharge me saying that I discharged from your hospital.
I don't know. So you make that decision, but understand that if you leave today, you won't have tube feet set up, and you are very high risk to fail worse, to have worsening malnutrition, worsening.
Y'all threw me out on my ass 4 months ago when I tried to seek help, calling me anorexic.
And that's not what I'm doing now.
I understand, but y'all threw me out on my ass when I tried to get help.
Yeah.
I've been trying to get help all year.
Yeah.
Since January.
So that's what I can offer. You decide with your husband and you let your nurse know, okay?
I'm just saying, y'all waited till the last minute when I finally found help in Virginia.
Yeah.
To try to help me.
I'm restarting tube feeds until about this afternoon. That's my plan now, so that we can still do nocturnal tube feeds tonight. So there will be a several-hour break to let your stomach empty and get back to a normal setting, so that when we start nocturnal tube feeds, it'll be a good trial. If you want to do the MRCP, I'll have the order in, and if you don't, you just tell them that you don't want to go down. If you decide to leave, I'll have your discharge stuff ready, but it's against what I medically recommend for you.
Right, but tell them why I'm leaving against your medical
And
recommendation.
it'll be in my discharge summary. I have no problem telling you.
Because I've been walking around, y'all been treating me like a crazy person.
Yep.
And I'm not crazy. And I found out I'm not crazy.
Yeah. Okay, you let me know what you want to do, okay?
I need a telephone.
Oh yeah, I'll tell your nurse. Just message your nurse.